So, what you have all been waiting for, I'm sure, we are going to talk about obstetrics and neonatal care. So, how to deliver babies and how to care for them immediately after they are born. So, we're going to talk about what a normal delivery would be like, abnormal deliveries, things that can't be delivered in the field, depressed newborns who need resuscitation, normal newborns, and what everything within that realm means. So, most deliveries nowadays do occur in a hospital. But occasionally the woman is unable to get to the hospital, or she perhaps chose to have a home birth and maybe something went wrong, and that's where you're getting the phone call. It really just depends on the situation. So we need to decide whether we have time to transport the patient to the hospital or whether we need to assist with the delivery on the scene. And so again, we'll talk about some times when we definitely need to transport because we cannot deliver in the field, or talk about when birth is imminent while we need to wait and deliver on scene. So just going back over some anatomy and physiology, we just talked about this with chapter 23, but we're going to hit the highlights again. So the ovaries, we have one on each side of the uterus, and each ovary contains thousands of follicles, and each follicle contains an egg. So again, you're born with the number of eggs that you will have for your whole life, which is kind of cool. And ovulation occurs approximately 2 weeks prior to menstruation, and that's when the egg is released, or it should be released. So you should have one egg released from the right side, and then the following month should be the left side, and then back to the right side. That's how it should work. It doesn't always. Sometimes you have more than one egg that is released. And so that would be like where you have multiples. That could be an instance where that occurs. Or if you have no egg release, because like you have something like polycystic ovarian syndrome, PCOS, where no eggs are released. So even though you go through the process of having a menstrual cycle, you're not actually releasing eggs. So there's a lot of different things that could be contributing factors here. Now, those fallopian tubes that attach to the eggs, they attach to the ovaries, and that's where the egg is carried out to the uterus. And so fertilization usually occurs when the sperm meets the egg inside of the fallopian tube. Now, that egg should continue on to the uterus as it develops into an embryo and implant in the uterus. When it doesn't, and it actually implants into the fallopian tube, that's where you have an ectopic pregnancy, and that could be potentially life-threatening. We'll address that a little bit further on in this PowerPoint. But for testing purposes, you do need to know that fertilization typically occurs inside of the fallopian tube. Now, once that progresses down into the uterus, we know that the uterus is the muscular organ that encloses and protects the developing fetus, and it's what produces the contractions during labor and helps to push the fetus out through the birth canal. The birth canal itself is made up of the vagina and the lower third of the uterus, or the neck of the uterus, which is called the cervix. So this is a picture here, and obviously this is an impregnated uterus. So you have a fairly large, almost close to full term here, fetus that is inside of that uterus. So the uterus is quite large. When it's not pregnant, it does look a lot different. That uterus is actually pretty small, but because it's a muscle, it can grow and expand and make more room as the baby continues to grow. Some other things that I want to point out to you here are the fundus and the placenta. You see those are up at the top portions there. Now the placenta can, wherever the egg implants is usually where the placenta begins to form. And so as we talk about placenta issues later on in this PowerPoint, I want you to keep that in mind. The placenta does not always grow at the top. Sometimes it could be on the side. And when it's down at the bottom covering the cervix, that's where we would have placenta previa, and that could be a life-threatening situation for the mom and the baby. So the vagina itself is the outermost cavity of the reproductive system, and that's what is completing the passageway from the uterus to the outside world so that the baby can pass. And then the breasts actually produce milk that is carried through small ducts to the nipple to provide nourishment to the newborn once it is born. And so that makes the breasts a part of the reproductive system as well, because they provide the nourishment for the baby. Now, being able to produce milk and feed our children is what actually is part of the reason that makes us a mammal. So that's pretty cool. So the placenta attaches to the uterine wall and provides nourishment to the fetus, like we said. And this example is showing you the placenta on the side. So again, it can happen anywhere. When it's down by the cervix is when it is most dangerous. But you see that placenta is joined to the fetus with the umbilical cord, and the baby has a little bit of room in the amniotic cavity. At this size, the bigger the baby gets, the less room they have to move around and the less fluid they have available to them as they get ready to be born. That placenta keeps the circulation of the woman and fetus separate, but allows substances to pass between them. So that means that there's no blood exchanging. The blood is there's a blood barrier there to keep that separate. That's why you don't always have the same blood type as your mom, because it can be different. But there are things that can pass through that membrane, like medications, and then also nutrients and oxygen. Those types of things are passed on to the baby, so that's really awesome. Anything ingested by a pregnant woman has the potential to affect the fetus. So when you're thinking about things like vitamins and nutrients, that's good. But when you're thinking about other medications or substances that could be potentially harmful to the baby, like drugs and alcohol, that's a bad thing. So we definitely want to keep that in mind. The umbilical cord is what connects the woman and the fetus through the placenta, and the umbilical vein carries oxygenated blood from the placenta to the fetus, where the umbilical artery carries deoxygenated blood from the fetus back to the placenta. And so I want you to keep that in mind, because this is very different than our normal vascular abilities. When we think about the normal human body, remember, veins typically carry deoxygenated blood and arteries carry oxygenated, with the only exception being in the lungs, where we have the pulmonary artery and the pulmonary vein that have flip-flop roles. And so this is much the same there. So you actually have the one umbilical vein in the middle and two umbilical arteries on each side inside of the umbilical cord. And so those are running all together there, but with oxygenated blood inside of the vein and deoxygenated blood in the arteries. The fetus develops inside of the fluid-filled bag-like membrane called the amniotic sac, which generally contains about 500 to 1,000 mLs of amniotic fluid, and that fluid helps insulate and protect the fetus. Now, just like with everything else in the body, you want to have a very stable amount of fluid here, and like I said, the bigger the baby gets, the less they have to move around in, but we need to have some. Because if you have too much or too little, it could both be dangerous. If you have too little fluid, the baby's not going to be able to move around and they're not going to develop the way that they should. If you have too much fluid, then you could actually have the baby able to move around too much, which is increasing the potential risk for the cord being wrapped around the neck or the nuchal cord. So we want to make sure that that fluid is being monitored, and if your OBGYN determines that there's too much or too little, that they are closely monitoring that situation. Now, talking about some normal changes that happen during pregnancy, this is systemic. So everything in your whole body is going to change. It's not just a baby growing inside of your uterus and you gain a little bit of weight. It is truly everything in your body transforming. And so there are respiratory changes, cardiovascular changes, and musculoskeletal changes. So the hormone levels begin to increase. That's critical to support fetal development and prepare the body for childbirth. So pregnant women are at an increased risk for complications from trauma, bleeding, and some medical conditions. And the uterus itself is shifted up from its normal position, making it kind of the point of gravity or the center of gravity. And so that means if you fall or anything like that, that's most likely where you are going to land. And so that's very dangerous for the mom and for the baby. The risk for trauma also increase with like car accidents and things like that. Rapid uterine growth occurs during the second trimester, and as the uterus grows, it pushes up on the diaphragm and displaces it. So your respiratory capacity changes with an increased respiratory rate and decreased minute volume. So again, your respiratory drive is kind of changing here because you're breathing a little bit more shallow and a little bit faster, making it difficult to, sometimes for physical exertion or walking long distances. Your blood volume and the speed of clotting increase. So the speed of clotting is really good. That's obviously there as a safeguard for delivery so that you don't lose too much blood during delivery. Same thing with the increased blood volume. As the blood volume begins to increase throughout the pregnancy, it is ultimately preparing to lose that blood during delivery. And so that's really important when we start thinking about not only delivery, but also any type of trauma that occurs where we see blood loss in the pregnant patient, because they are going to be able to compensate for blood loss a lot longer than others because they do have that reserve blood loss. Your cardiac output also increases because you've got extra workload put on the heart now as the body is taking care of the mom and also the baby. You got changes in the cardiovascular system, again, for the demanding the supporting the fetus and the workload of the heart. So you might see an increase in your heart rate, but is actually overall generally a decrease in the blood pressure. In the third trimester, there's an increased risk of vomiting and potential aspiration. This says following trauma, but it could be really anytime. Just think about the displacement of those organs. And as we mentioned, as the uterus continues to grow and it's kind of displacing everything and pushing it up, putting more pressure on those organs, that's a real risk there. So weight gain during pregnancy is normal. These are challenges for the heart and impact your musculoskeletal system as well with the increased weight. Now, typically, most people on average, the normal healthy recommended weight gain is between 25 and 35 pounds on average. Now, some people gain less, some people gain more, and it's really depending on a lot of things. It could be related to underlying medical conditions. It could be due to dietary intake. It could be due to hormone changes. But overall, the joints do become looser and less stable, and so you're more prone to falling. Now, this happens so that it can aid in delivery and not cause any injury to the pelvis and things like that, and allows that pelvic cavity to really open up, but it does affect everything. And again, we already mentioned that the body's center of gravity has changed and becomes that abdomen as it continues to grow, which can increase the risk of slips and falls, but also make those changes or potentially dangerous if the person were to fall and land on their abdomen. That's a danger to the mom and to the baby. So looking at some complications of pregnancy. So overall, most pregnant women are fairly healthy. Pregnancy itself is not a disability by any stretch of the imagination. Pregnant women are still able to work, still able to do a lot of things that they can do in their normal everyday life. But they might have some complications that's kind of outside of the norm. So some may be ill when they conceive or become ill during the pregnancy. If they are already sick prior to getting pregnant, like let's say they're already a diabetic, or they already have high blood pressure, or they already have respiratory issues, then those things might be magnified during the pregnancy and become even worse. But sometimes a normally healthy person can develop these things during the pregnancy, particularly related to gestational diabetes and hypertension, which would be preeclampsia. So again, we'll take a look at those as we're moving on here. So looking at diabetes, if it develops during pregnancy, you've not previously had it, then that's termed gestational diabetes, and a lot of times it resolves after delivery. So it might be that you're having to take medications or even insulin, depending on the severity of it during the pregnancy, but it doesn't mean that you're going to have diabetes for the rest of your life. It just means that you had it and had issues with your insulin and glucose levels during the pregnancy. So the way that they actually come in and test for gestational diabetes is that they will check your urine every time that you go to the doctor during your regularly scheduled visits, and they're looking for things like glucose and proteins in your urine that would indicate an abnormality. But every pregnant woman has to go through glucose testing as well, where you actually drink a bottle of glucose, and it's kind of similar to oral glucose, but it's in a liquid form, and so you actually drink that. And they monitor your blood sugar after an hour. And then if that's good, then no further testing is usually required. But if it's not normal, then you might have to do a 3-hour, 5-hour, or in some really rare cases, an 8-hour test that I've heard of some women having to do. So if you have it, it means that you just kind of have to watch what you're eating and your activity levels throughout your pregnancy, and you're more prone to the baby having some complications and maybe needing some additional help after after birth. It can lead to very overweight babies as well, like 10, 11, 12-pound babies, which can be difficult for the mom as well. But again, usually this resolves itself after the baby is born, and there's generally no lasting effects or long-term complications for the baby if there's not anything else underlying. So I'm going to stop this portion of the video here, and I'll catch you guys in part 2.